All right, July 15th. Over to you, Simon.
Okay. All right. So, got some questions, two questions. Um, for an 8-year-old patient, we've completed upper lower expansion. So we've done turning the screws. Next step is to make a retainer with the bow to tidy up incisors. Do you have the patient continue wearing upper stage 1 passively for several weeks before scanning for the upper retainer? Or can I scan right away to order a retainer? It can take 6 weeks for the appliances to arrive. So patient will be wearing the same one passively anyway during the 6 weeks while waiting for a retainer. Is there any other reason I shouldn't scan once I'm sure we are done? Um, Once you've developed the coordinated arches and you're ready to um, continue the next step, which is tidying up the alignment of the incisors. Yeah, you can scan straight away. So if you've done your expansion and the plate's well fitting and there's no kind of shuffling around or issues with the plate not fitting, because you're wearing it full time, then your stage 1 appliances act as the existing retainer. And when you take the scan, and if we continue to wear the existing stage 1 appliances without expanding, then everything should stay pretty much as they are. And then there's no reason why you can't scan and make a new appliance, so long as you're no longer doing any active movements in the existing appliance. So if the existing appliance is being held passively, is being worn full time, well fitting and retentive, then you can as soon as you're ready, you can scan and get new appliance made. Of course, during the construction time, keep wearing the appliance passively, make sure there's good retention and it's being worn all the time. Next question. For early mixed dentition cases where the child presents with a deep overbite in a primary dentition, is there a benefit of starting expansion prior to the permanent size erupting so we can control the overbite of the permanent sizes? So would it be worth encouraging treatment in these cases as soon as the sixes are erupted enough to place a rest versus waiting until around 8 years of age? So early mixed dentition begins when the permanent teeth start to erupt. So for some children, that's the 6-year-old molars first. For other children, it's the central incisors, usually the lower. So you can get lower centrals coming out first, and then concurrently upper 6-year-old molars, and then lower 6-year-old molars, and then upper central incisors, kind of generally. Can be concurrent for everything, it can be staggered. Why would it be staggered? Why would it be concurrent? If there's no malocclusion, there's good spacing, everything kind of happens all at once. If there is crowding, then and malocclusion, then the teeth that aren't crowded erupt usually to time, and the ones that are crowded are super slow because they got nowhere to go. So more often than not, when we're dealing with children with malocclusions, the molars erupt earlier than the incisors, or sometimes one incisor erupts, the other doesn't, or or something of that nature. When we have a really deep bite, we've got a situation where class 2 has developed, or could also be class 3, of course. You can have a reverse deep bite, but assuming we're talking about a division 2 type of relationship or a division 1 where there's a huge jet and teeth are unopposed, the front and over erupting, we are trying to reduce the likelihood of permanent teeth continuing down this path. So first off, we recognize the structure issue, imbalance, malocclusion, and then we've got to consider, well, what might be causing this relationship. More often than not, it is to do with the posture, of course, and the etiology of typical deep bite comes from the tongue resting between the molars in a rest posture that is a posterior open bite. The tongue sits between the molar teeth but doesn't quite come into contact with the incisors. So we have a freeway space where the posterior molars are kind of held at rest between the tongue. The incisors are unopposed and over erupt. The most common version being a division 2 malocclusion where the lips are together. The teeth are apart with the tongue between the molars and the incisors are apart, unopposed, but still in contact with the lips. So you end up with an over-eruption of upper and lower anterior segments and a retroclined position of the incisors because of the lip pressure. So how do we resolve this? When do we step in? So if you're seeing it in the mixed dentition, we know that if we don't do anything, the malocclusion is likely to continue because the rest posture isn't going to change. Without therapy, and we will change the incisors over, and the permanent incisors will exactly follow the same path because the posture stays the same with the tongue between the molars, lips sealed, putting retrusive pressure, and incisors unopposed, so they change over and then they erupt the same malocclusion as in the primary dentition. So how do we resolve it? Well, we've got to change the posture. We've got to get them to rest with their lips together, teeth together, tongue fully inside the mouth, on the palate, and the floor simultaneously. What would stop that from happening? So if we have a pre-existing class 2 relationship with the division 2, if we get the children to rest with their teeth together, they usually don't benefit from that because you're keeping their mandible usually in a retruded position or in a class 3 situation, a protruded relationship. And neither of them are comfortable because the TM joint either stretches the ligament or compresses the distal ligaments. And so it's uncomfortable to hold that position, so it's very hard to get a child to hold that position. So what we would need to do is we would need to change that relationship so that we level and align the curve of Spey and often the curve of Wilson. We have to make enough space for the tongue to be comfortable, because often associated with the deep bite is insufficient transverse and out of balance AP. So we have to very often develop space with expansion, and we've got to level and align by initially tipping the incisors forward and then holding the changeover teeth from over erupting, and then retraining the child when the structure is better balance to rest with their teeth together, tongue on the palate and the floor simultaneously, filling the hole in a portion of the mouth, and lips seal. Certainly Division 2 children rarely have nasal obstructions, so nasal breathing is not difficult for them, but in the retrusive position that they develop because of the deep bite, the back of the tongue pushes the soft palate up against the laryngeal space and occludes the nasal pharynx to oral pharynx communication. So we can't train them to keep their teeth together at rest because it's uncomfortable on the joint and they can't breathe through their nose in that circumstance because the soft palate is driven up by closing the nasopharynx off. But if we level and align, we expand, we have a better chance of training them to stay closed because the mandible is not pulled back as far and the tongue sits a little bit further forward in the mouth. When is the timing to do that? So in a mixed dentition, in the early mixed dentition, we're in a changeover period because the molars are erupting. Generally, as they are erupting, it's a very difficult time to build appliances because of teething discomforts and the fact that everything is liquid in movements in the posterior region where erupting teeth can displace the appliances. So the next step would be when the sixes are in occlusion, and then the following stage would be when the permanent incisors are starting to erupt. So timeline-wise, it'll be approximately 7 or approximately 8, assuming the scenario that you've explained. Once the sixes are in occlusion, then there's no reason to wait until the permanent incisors are through. If we wait until the permanent incisors are through, we're a little bit easier because we've got a slightly older child and you're more likely to have the sixes nice and socked in and you don't have to worry about the variable. But more often than not, the permanent incisors will have over-erupted into the deep bite relationship. Now, of the things that we can do with the removable appliances, obviously intruding incisors is very, very difficult because we have only the cat wires at play. You can, of course, use limited fixed braces, but you can't use limited fixed braces until the laterals are through fully, so you can't really do that until about 9. So if the sixes are through and we got a deep bite, there's no reason to wait until the incisors change over, just step in straight away. Advantages there are when you build the appliance, you can use the cat wires to hold the permanent incisors from over-erupting. That said, deep bite patients tend to break cat wires very easily because of the interference in the bite. The lower incisors to the cat wires. So sometimes you have to use thicker gauge cat wire, and sometimes you have to use a bite opening cover, occlusal coverage, just because of the nature of the malocclusion you're dealing with. If you're using bite opening coverage in the occlusion, it's critical that you pay attention to the erupting incisors and control them with the cat wires. If you don't pay attention and you have a bite opening grab so that you avoid breakage of the cat wires, then it's very easy for those permanent incisors to over erupt because the bite is jacked open and those teeth, if the posture hasn't been corrected, which it won't be in the initial phase, those permanent incisors tend to erupt very easily. But yes, so short answer, of course, that was the long answer. The short answer is yes, absolutely. So long as the sixes are erupted, you can start straight away. Don't have to wait for the incisors to change over or erupt into place. Okay, so that's all we have at the moment, question-wise.
Okay, we've got Dr. Ghana, Dr. Toon, Dr. White. Any questions you want to submit in the Q&A or unmute and join the panel? Have a chat. Just type yes if you've got a question. We'll give you a few more minutes. No questions tonight. Been a long day. Thank you, Dr. Kevin. Okay. Let's see, Dr. Sony or Dr. Tun. Any questions? Thank you, says Dr. Kana. Okay. Yeah, Dr. Tun, do you have any questions? Anyone else? Dr. Sony? Okay, looks like, let's see. I think that's about it. All right, it's an early one, Simon. Thank you, thank you.
Okay, thanks.
Just one little quick announcement. We're going to be launching our challenge soon. We have a 30-day GoPex growth challenge. So it's something that we've been working on for a little while now, which has been exciting. Let me just kind of share my screen for those of you who might be interested. Here we go. This is our new website. Will be launching officially next week. Still doing a little bit of testing, but I think everything seems to be working. But we have a free growth protocol masterclass. We're creating a new GoPex growth community inside a private school platform. It's kind of cool. We're still kind of setting that all up, but next week we should be kind of officially ready. But yeah, you can get, for those of you who are new and don't have Dr. Wong's GoPex ebook, or maybe you have patients you'd like to, educate them on the protocol and kind of give them some awareness about these exercises, as well as, how the upper and lower arches can be expanded and so on. So there's some free training here. It's not just for dentists, and you could be an allied health professional or a concerned parent. And then there's an optional upgrade to our 30-day GoPex growth challenge. So this is a like a 4-week, 30-day challenge. So my two boys are actually going through the protocol. They're having their they've got their upper and lower removable expansion appliances just delivered. So we're documenting their entire journey over the next 12 to 18 months. And next month we'll show the first episode of the vlog, which is fun. So we have a 30-day challenge where it's essentially it's 7 hours of pace AGDCE, right? So it's a proper training course. We've taken the best of our 2-day intro programs from the past and additional training that is not part of the 2-day program. For example, we've got about an hour of Simon supervising real cases from students, current students, past students. So it's a nice selection, just so you can see what it's like to have your cases being supervised and getting mentored, if in case that might be of interest. So it's just a special offer. If you opt in, it's $97. Normally quite a lot more, but we've got this special offer at the moment. Um, and for parents, for allied health professionals, it's only 40 odd dollars, and for parents, for non-dentists, it's like $17. So, we'll be doing the exercises every day and encouraging everyone to put these GoPex exercises into practice. Often they're kind of a second cousin. Everyone kind of looks at a lot more interest in the appliances, but really we call it postural orthodontics for a reason. It's very, very crucial part of preventing relapses and retraining the oral posture. So, my brother is Dr. Simon Wong, and he's the one who's supervising my two boys' cases with the clinician, Dr. Rose, who lives not too far from us, and so we'll be, sharing that journey, uh, over the next 12 to 18 months. So, if let's say if you select this, give you a little of a little preview, you kind of select where you're at, um, and then you just fill out your name. I'll just put my name, and then it sends you get the free bundle, and you get the ebook, you get free access to the school community. And then there's this one-time special offer, right? So this is $97. Eventually it'll be a few $100s. But we've got this, we're launching for the first time this challenge. It'll be probably on a monthly basis, right? So the first Monday of every month. And this is also a good way to educate your patient base. We have a lot of students who go, how do I promote this to my, community, get the word out? Some of our mentees have asked as well. So we've created this to allow for them to share this, share the GoPex ebook for free. The challenge is optional, this growth challenge, and for the parent track, they don't need 7 hours, right? So that we've got about 2 to 3 hours of training, actually closer to three. They can join these Q&A sessions and just listen in, right? As a $17. And then, if it's a challenge, you really want someone committed, right? If it's free, they'll forget about it, right? But if they're really committed to, retraining their child's poor oral posture, this is a great little 30-day challenge. And if we give them access to a whole year, theoretically they can redo the challenge every month. Um, but for the dentist who wants the CE, for example, then we give them the full 30 days to complete, the 7 hours of training, and we have weekly Q&A, just like you guys are on now, so they can join and ask their questions related to the curriculum. And the curriculum is quite comprehensive, from GoPex Foundations We go through all the exercises. We have some nice downloadable worksheets and a one-page summary, some new collateral, the evidence, the case presentation method, and appliances. We go into detail, give you the exact contact of where Simon orders his appliances from. So all that's covered. And we even give you sample, as I said, a sample of the appliances. Most CE training is slides and theory. This is different. 50 minutes of Dr. Wong thinking through real cases submitted by actual students out loud in real time. 7 sessions, 5 dentists from around the world. You'll watch him read a child's face in 60 seconds, replace retainers with the tongue, know exactly when to add braces and when to ruin a face, and finish cases most dentists would refer out, plus what that skill is actually worth. And these 7, they're just the doorway. All right, so we get a nice sample of what we call our case study vault. Yeah, so it's a brand new program. Really important aspect is, getting that discipline into putting into practice these simple exercises, the chewing, counting, smiling exercises. So it's something that is really the foundation of postural orthodontics. All right, so excited to launch it. So if you're interested, at least check out the free. Let me just give you the link. The free, the free page where you get the free masterclass. If you're new to postural orthodontics, here you go. Get our GoPex ebook for free and consider joining our 30-day challenge. Alrighty-o. All right, cool. Anyway, just a little soft launch. Might be some bugs that we're cleaning up in the next week or so, but we're excited to share this and get the word out. We'll be running some ads and in the US, so you might see some ads promoting the free masterclass and our GoPex challenge. So anyway, hope to see you on our GoPex challenge next month. All right, cheers. Oh, if you have any questions, send us an email or reach out. All right, cheers, everyone. Thanks. Bye.